The different cosmetic options we have at our practice are we have. The first thing I always go to is your braces, either Fastbraces or Invisalign, and that's a quick way to kind of straighten someone's teeth out. Typically, what I find with most of those patients is they may have had braces when they were younger, or they didn't have braces. They're kind of a little bit later in life. They maybe didn't wear the retainer. I would probably say, 9 out of 10 people don't wear the retainer. Yeah, and so your teeth are naturally going to shift back to their natural position over time, and so people are frustrated with that, but they don't really know what the solution is. Well, the cool thing about Fastbraces is it's a revolutionary bracket that moves the root of the tooth and the part of the tooth you see above the gum at the same time. So typical treatment time for regular braces is 18 months to 24 months. I can have someone smile back in 4 to 8 months. And it's fewer visits, and so that's a good solution. Then you have your Invisalign, which is someone that may be more self-conscious about not wanting to wear the brackets. The treatment time will be a little bit longer than the Fastbraces, but the series of trays can straighten their teeth. If someone doesn't want braces, the first go-to in my practice, then I would recommend either veneers or crowns. Some people aren't always a candidate for veneers, especially if they have a lot of large fillings on their teeth. You want to be able to protect those with a crown. But nowadays with technology, you can put a veneer. I can put a veneer from my lab, and I can put a crown on you side by side, and you wouldn't be able to tell the difference between the two. So it's kind of semantics, but really it ultimately comes down for those two options: what's best for the patient, what's best for the tooth long term. I do some chairside veneers, chairside bonding. That's kind of fun. I do enjoy that because you're actually kind of the artist at the as the patient's laying in the chair, you're actually creating the restoration or the tooth right there while they're waiting, and so they walk out with a change. It's a good solution. It's a little more economical. It's not going to last as long. It's going to tend to stain after a couple of years, and so it's going to need to be redone. But it's a good fix for people that aren't ready to do something more permanent like veneers or crowns.